Good morning, everyone. My name is Steve Longo, and I am DHHC's board president. I'm happy to have all of you here. I know now it's a difficult time since we've been in a pandemic the last couple years, and we don't have a large physical presence with us today. And I know that Zoom is not always the easiest platform, but we do have some people with us today, so we are going to go ahead and proceed with our agenda. And hopefully we will be able to increase numbers for future events. Today is community comments. It is our opportunity to get feedback from the community and for community members to share their comments, concerns, or anything they'd like to share with us. The DSS does require us to receive feedback from our community members, ideas, suggestions, concerns, or anything that would be shared with DHHC staff and board. This is what we do to make sure that we're able to involve the community to make sure that DHHC can continue to provide services. This is something that we do normally every August, and that is what our bylaws dictate that we do. There is a little flexibility if August doesn't work, but our bylaws, we are currently working on updating the bylaws with our lawyer to add a little bit more flexibility as well as to kind of make sure that we are able to cover up everything while we get everything in order. We are not allowed by law to make that many changes, but we want to make sure that we are in accordance with other bylaws with other organizations. So here today we have 4 board members with us. We have 1 more who's on their way. We do have a total of 7 board members. 2 are not feeling well and 1 already had a previous commitment. So today we will share some short updates, and we will also welcome some people here to also share updates with what is going on here at DHHC. We have Jesse Lewis, who will be talking about the DAC or ADC and the AC. If I can welcome Jesse.
Hello, everyone. My name is Jessie Lewis, and I'm the project director, manager here at the agency. And so first I want to go ahead and just share the concerns and comments from community members that have been made throughout the course of the year. And we'll also be sharing more specifically 15 comments that were shared by those who took the time to fill out the survey. So the number of participants for that survey was not very large, but we'll show you what we got. So the first question on the form says, if you do not go to DHHSC's workshops, what stops you from going? So I won't list everything that shows up here on this graph, but a lot of it was that a lot of people were too busy to fill out the form, or they didn't remember, or too busy to attend the workshops. But most of them said that it was because they were busy. All right, next question. Now this question specifically was in regards to the Martha's Vineyard event.
Yeah, what Martha's Vineyard and other
And other events too, such as Valley Death Festival, like I said, Martha's Vineyard, our summer program. So if the question is, if you do not go to these other events, what stops you from going? A lot of times it seems it was a conflict because of the date and time. And so because there's such a low response, we don't know if the sentiment of the community at large represents that.
not request services.
And then the next question is, if you do not request services from DHSC, why not?
I-54.
And at 54% of those who responded said it didn't apply because they do ask for services.
Clear to know
We
about.
were really curious to know about those who aren't requesting services, what the reason would be, and why they're not coming to seek those out. Because we want to know so we can make those services more feasible for those members.
Services.
Now, the other question focused on what services and or events would you like to see offered through DHSC? And about 56%
Were.
of those were, 36% was because of health and safety workshops.
Yeah, and we'll watch them there.
And so by looking at this, we can know what else we can offer to meet the needs. And so for anyone else that's watching, please let us know what changes you may want to see. So here are the responses for things that you would
Sign and show.
hear at DHSC. So they would like to see more of the sign and sew skill. And then DHSC, it was saying that they would like to see,
Not clear what it means.
their comment wasn't very clear here, but
That's the way out.
there's a sentiment of having a blessing that we have this agency here. And others are okay with the agency as it is.
Certainly, I mean, y'all need it.
And to police common sense. And then the other was about health situations. Now the next question is, if you had to pick one of these for DHSC to focus on, doing system advocacy efforts, which do you think is the most needed? So there were 3 common responses. The mostly responded was in regards to hospitals. And for the next portion is for services, events, and workshops that are requested. One was the online CI support. The other suggestion was perhaps a jewelry making class, to continue the monthly CI support group, providing individuals with expertise in hearing technology, including cochlear implant area. The What Did You Say? Monthly Zoom meetings. And presentations by people that are familiar with various phone apps that would be available for the deaf or for the hard of hearing. And for have attended the CI group and other support groups. And the 4 people from the CI group responded to this survey. The other question is what people like about DHHSC. And one said, since I no longer live in the Fresno area, I appreciate the efforts being made to hold WDYS, What Did You Say, and cochlear implant support group meetings on Zoom and in person.
Opportunity.
The other is open to new subject areas with accommodating attitudes, helping anyone in the community that needs it, including with the What Did You Say group, and lastly, support group for deaf and hard of hearing. And the next question was, how can we be better? One had no suggestions. Another comment was, keep up the good work. The other is it's important to have in-service education for staff to know about the latest changes to technology for hearing aids and CIs. And the other is a 1 hour session a month would be
Yeah, and all of this is from the same.
once a month. And so again,
I really
those
didn't-
comments were coming from folks that are in the CI support group. Then the other question was, what concerns would you like to share? A lot of them had nothing to add. One said, I'm happy with the services provided. The other said, yeah, no concerns or problems. And so that was the feedback that we received from the course of a year. So as you can see, it's not a lot. And so we're hoping that this year we'll be able to welcome more comments from the community. So if you're not sure how to access that form, you can let us know. And if you don't feel comfortable with the English, we can sign that for you. And also part of the advisory council. We are planning our elections, but there doesn't seem to be a large interest in individuals wanting to join this council. And so if you are interested, please contact us. And then that way we continue our voting procedures through the online option. Now, as far as what AC members do, if they do attend
1 hour
AC
meeting.
meetings, they are 1 hour long, 4 times a year. Also, we ask community members about their concerns and requests, and we bring that information to the meeting. We also tell the community about DHSC programs and the services that are offered. Also collaborating with DHSC staff and the board is what is going on. Also, there is a participation of at least 4 deaf community events that are held at DHSC every year. And lastly, assisting DHSC with events and fundraising when requested. Now, some other important facts that you should be aware of.
Can't Fresno.
For Fresno's AC, it can have up to 8 members. We have none, but we can have up to 8. And the term is 3 years. So you can be in that role for 3 years, and then voting can take place a second time, and if that is granted, then it's another commitment for 3 years.
And spell out simple and
And members take turns filling out forms in order to get minutes in place as far as what was discussed in the meetings, what the concerns were. So that is noted and then sent to us. And then we provide that feedback and information to the appropriate persons.
and address.
And then we can have any of those comments addressed or issues addressed.
Just send me out.
So please let me know if you're interested in being a part of this group. And you can contact me at jessiel@dhhsc.org. Thank you very much. Any questions? Okay.
Thank you so much, Jesse, for going over this. And it seems that there are some similarities between AC members and board members. Board members have an interview process and selection process. AC members, and must be able to meet with the executive director. AC members are really the bridge from the community to the board. They are elected after they talk to the project director, and it's essential to have them because they are the ones who are out in the community. They are the ones taking notes, getting involved, getting the input from the community. So the AC is a great place to serve. And again, it's a 3-year term. You can have up to 2 terms. So thank you so much, Jesse, for going over that. Okay, next slide, please. Now, I will be talking about the community events and what is happening. It's not my community or our community, it's your community. So we're talking about suggestions, ideas. Last year, we had 2 years ago actually, time flies. We had a lot of VRI issues being brought to our attention and concerns about VRI, about where it can and should be used. And the community was confused because they are starting to increase the use of VRI in schools, at hospitals, and they're saying, what happened to the in-person interpreters? Why do we have an iPad in front of us now? And it does not solve all issues. It's not really the best answer, right? It's technology. It is a piece of technology which is dependent upon good Wi-Fi. If there's the Wi-Fi or internet is not good, then we don't have a good picture to see the interpreter. It depends where it is. There can be a lot. Where it's placed, what the interpreter can see. So that is why we needed to have this discussion 2 years ago. And it has become more widespread in hospitals as well as, businesses have been really good about, okay, yes, VRI businesses are only charging 15 minutes at a time instead of an in-person interpreter charges a minimum of 1 hour, right? And so it's easier to call a VRI interpreter because all you have to do is press a button on an iPad. But it's not always the best for the patient to use VRI services for their whole hospital stay. So Michelle, the executive director, did gather information, and we had a deadline, and she can talk more about that now if she'd like. Okay, so please welcome Michelle. Hi everyone, thank you everyone for coming today. I know that VRI has been and still is a hot topic. I don't think it'll ever not be a hot topic. And especially now during COVID, the use of VRI has dramatically increased, which has increased the challenges that we have. They're saying for health and safety reasons. And so now, it's becoming more of an issue for us to, we want to challenge that for health and safety for people in the room. But now that things are going, quote unquote, more back to normal, we want to clearly define when and how interpreters via VRI or in person should be used. So we talked to the Disability Rights of California, and we will have an ADA workshop this afternoon. I encourage all of you to stay this afternoon. We've been working with them over the last couple of years about different issues. And we were working with the DOR a few years ago. They were helping us, and also the Disability Rights Council. So there is one specific hospital here in the area that I will not name. But this afternoon, if you have any concerns, please stay for the workshop. And after the workshop, you can meet with the lawyer and help fill out forms to express your concerns for this particular hospital. I asked DRC, when is it not appropriate to use VRI? They sent me a list, and some examples were, if the patient is deaf and blind, if they are deaf plus, if those who have visual challenges, because the screen typically is small and hard to see, for those who have back and mobility issues, if they are laying down, they may not be able to see the screen. And the last one that I remember was for children. They said it was going to be too hard for children. So there were a list of 5 different populations that is not recommended to be served with VRI. The challenge, though, is the lack of availability of interpreters. The colleges and universities are struggling as well by not having enough interpreters, and so they are starting to contract with VRI companies, and VRI companies are thriving because of this. And so we do not have a lot of in-person interpreters, which is the question, is that better than nothing? Because if you had an in-person interpreter and a VRI interpreter, we're seeing them team assignments more and more. And it's been tough Because if you don't have an interpreter, would you prefer to have one, but one interpreter can't do an assignment by themselves, depending on the length? And it's been an ongoing challenge, but we need to know what our rights are as patients. And also the ADA stresses effective communication. And what is being done out in the community in the health field may not be effective communication. Because my definition of effective communication or what's effective for me is different for me than it is for you. So what works for me may not work for you, and vice versa. So we need to speak up. So we're providing that training about how to do that, right? If no one's advocating, if no one's raising concerns, then the healthcare profession can say, oh, well, everything's fine. So contact us, and we can work with you to advocate to your medical professionals, because we know who we are, and they know who we are, and they'll say, hi, it's DHC's here again. But sometimes they say VRI is fine, and maybe for a particular patient, VRA is fine, and that's fine for that person if they're willing to do that. If there's not good enough internet, or maybe they don't understand the signs of an interpreter based on the regional signs or such, then we just know that it's not a one-size-fits-all, and not everything that's best for one person is best for the other. So we need to speak up. And our job is to advocate and educate, to partner with the community. And so please come this afternoon. They have done a beautiful job talking about the ADA, and will share that with us this afternoon to talk about your rights and to help you fill out any forms you need for any VRI issues you may be having. And again, it is for deaf blind, deaf plus, people with mobility issues, children, and such, for wide effective. Okay, thank you so much, Michelle. One thing I wanted to add is, right, we're thinking about like education. So if there's VRI in the classroom with the teachers in person, and then you have the iPad, it's hard for the deaf student to participate if they have a question, when they have a VRI interpreter, and that is one thing. It should not be allowed in the classroom. I know Michelle was talking about healthcare settings, but I think in education in general, right, we just need to be better prepared about what and when is the right time to use VRI. I want to take this opportunity to welcome board members that are with us today. We have two new board members. I've introduced myself. My name is Steve Longo. I am the board president. I also want to introduce everyone else. You want to go ahead and get up here and introduce yourself? Okay.
Hi, my name is
Hello, my name is
Jen.
Christian. I work at Valley Children's Hospital. I am an audiologist,
For kids,
specifically for kids
big kids.
and big kids. I want to be able to advocate and help however I can. And thank you for having me.
Christian, thank you. We need a name sign for you. Oh, here you go. Okay. This is Christian's name sign because of his beard. Okay. Great. Thank you, Christian. The next person I would like to introduce is Patty. She is also new to the board. She is from Northern California.
Hello, my name is Patty Sillo. And I lost my train of thought. Okay, well, yes, I am from San Luis, Salinas. And we do have a DHSC there. with Crystal. And before that, I also worked in the office. And then later got more involved in the educational field, working in a deaf program. And then 2 years ago, I became a deaf ed teacher. And so now I am teaching ASL in public schools for both deaf and hearing kids. And just based on what Michelle was commenting, I have seen a lot of that. Last year, we had an increase of BRI interpreters in the classroom, and just because we don't have enough interpreters in person, so it really puts us in a tough position. And we do have a few students that, you know, it's really difficult to navigate the dynamic with working with the interpreter on the screen, and so it's hard for the student to be able to see me, to see the interpreter, to get their turn taking in. It's just difficult. So thankfully this year we have enough in-person interpreters, but yeah, I have some experience with that. Well, thank you. And that's a little bit about me.
Thank you, Patty. Yes, so Kristen and Patty are new to the board. And I think last year, Jamie joined last year. If you want to get up and introduce yourself.
Hello, my name is Jamie. I have 4 kids. And my youngest is hard of hearing. So I was actually shocked because generationally, with the way it turned out with my husband and myself, my 5-year-old was tested, and we just found out that she's hard of hearing. I've been on the board for a year, and this December will make it 2 years. And that's it for now. Oh, and I'm from Madera.
Thank you, Jamie. As you notice, we have a wide population that we can serve, and that we have Jamie's in Madera, Patty's in Salinas, and some of us are in Fresno. So there is diversity amongst locations, as well as backgrounds. We have people people of color, we have people from different areas, which is important to include all the diversity. We have 2 members that are sick and 1 who had a previous time commitment, so 3 additional board members were not able to make it with us. We have Anna, Jessica, and Nicole, who are also serve. Nicole is our vice president, and she actually has COVID, so she was not able to make it. Jessica is sick, and Anna was already had a previous commitment to be out of town. So we do have 7 board members currently, and we had 3. So thank you to Michelle for helping us reach out to people who were interested in joining the board. She recommended some people, we reached out to them, and so I want to thank Michelle for making this all happen. We have, like I mentioned, we are revising the bylaws. There were a lot of errors in the bylaws and a lot of things that needed to be updated. So we saw the new Robert's Rules of Order, which we refer to as RRO, Robert's Rules of Order. That is something that has been used throughout history. It was written to be able to effectively and efficiently run professional meetings. So board meetings, how to do amendments, how to pass motions and such. And so we want to make sure that we're able to run our meetings more efficiently. Again, we are a nonprofit organization, so we have rules and regulations that we must follow. So we are in our 12th edition, so 2020 is the 12th edition. And we needed to make sure that we make some revisions because we had nothing on there in terms of technology or being able to do things remotely. So we are able to now say that we can host meetings remotely. If a board member is sick, they can still be present via Zoom. However, we have that technologies work for us, but just that they are able to be remote. So things are evolving, and we want to make sure that we are not adding to confusion, but we're able to clarify some of those things. So we want to make sure that board members can be involved in the meetings. There are some other things, some other examples of what we're going to be changing, but yes, we felt like we wanted that the way things weren't as productive as they could be. So we wanted to make sure that we're able to have the meetings and that we can do in action items instead of just reports. We want to be productive to make action items. And before, it said that we needed to have at least 4, but we wanted to make sure that if we can have more, it's at least 4, not just 4 meetings. So we want to make sure that we have that flexibility as well, so it's not just 4 meetings, but at least 4 meetings. So we've made those changes, given them to Michelle. Michelle has given them to the lawyer. The lawyer is reviewing them to make sure that our verbiage is correct to be effective in bylaws. And once they are solid, we will be able to publish them. I'm thinking it'll be another couple months. And Michelle is indicating hopefully September. So it is a long process, and they have other priorities they're also working through. So once they get through our bylaws, they will give them back to us, and hopefully at the an upcoming board meeting, we can get those out. We also have board policies and procedures about how we operate as a board. The policies are more of what we can share with the public and how the public can share with us. So the board must have those posted, or they must be made public so that people can see and make sure that we are handling business appropriately according to the policies and procedures. Michelle has been involved with that as well as part of the interview process to know how things are done, and making sure that the policies and procedures are in accordance with the bylaws. So board's policies and procedures can be changed. They are more fluid than bylaws. Bylaws are a lot more stagnant and must be, again, reviewed by the lawyer. So we want to make sure that, it does a long process to get bylaws revised. We want to make sure that we have those things also written in our policies and procedures. Hopefully we'll have those completed this year, and we can get more board members. If anyone's interested in joining the board, please contact one of us up here. We are very excited for VDF, Valley Deaf Festival. Michelle will talk a little bit more about VDF, and it is the largest event that we have for the deaf community in Fresno. Everyone knows about the Valley Deaf Festival. And also, we are having our 40th anniversary. Can you imagine that DHHC now has been here for 40 years? So we are planning now. It takes time to reach out to facilities and vendors and all of that. So it does take time to plan, but we are working through that and getting the board, the AC, and the staff involved so that we can make this event and celebration happen. I remember attending the 30th anniversary. That was only like 8 years ago. Wow, I'm getting old. So that was 8 years ago. And the 30th anniversary had a large turnout. I hadn't attended one before that. and then COVID happened, and I feel like a lot of things have happened in the last few years. So we are trying to slowly but surely make our way back into the community. I know a lot of people have become comfortable staying at home, so we kind of want the community kind of to break out of their shell a little bit and become more social. That is our goal. So we have our 40th anniversary to look forward to. It will be here before we know it. Do you want to talk about that a little bit more? Okay, and here's Michelle. Okay, before we start, I wanted to say that for the board, I am thrilled to have different members, and that we actually have members now representing each location or each of our outreach offices. So we have Salinas, Merced, Madera, Merced. Jessica and Nicole are from the Visalia area, and so Jessie has really helped me reach out to people. Thank you for Jessie's help for helping me get in contact with Patty. But it's been a team effort. And some people may not feel ready to be on the board. If you're not ready to commit to the board, you could be on the advisory council. The AC First is really kind of that baby step to get a taste of what it looks like to be part of the representation for DHC. But yes, Jamie is saying yes to, she did that too. So, right, what does it look like to be a part of DHC leadership? So please consider being a part of AC if you're not ready to be a part of the board yet. Okay, now for Valley Deaf Festival, it is going to be our 31st anniversary. And I know that because of COVID, things are different, but we did not have it for 2 years, and it is time to have another in-person event. People are isolated, they feel lonely, and we feel that it is time to have an in-person event. We will be handing out masks. We have many masks ready to distribute. We will have hand sanitizer at various sanitation stations, and we want to make sure that we are prepared and safe as well. And it's going to be in the Commerce Building. The Commerce Building is huge. It's where the Home and Garden Show is. It's a larger venue, so we wanted to allow more room and space for social distancing. So the costs have gone up for everything in the economy. The cost for the building went up. The cost for food has gone up. The facilities who decorate and provide the curtains have gone up. Price of table and chairs have increased, and so everything has gone up, and that's why tickets are now going to be $15 for adults and $10 for children. But please buy them in advance. If you wait until the last minute, prices will increase $5 at the door. So it'll be $20 for adults, $15 for kids at the door. So please make sure to buy those now. If you feel that you can't afford that right now, you could save, $5 a month, and then purchase your ticket in a couple months. And we will, if you want to give us $5, we can keep track of that as well. We also will have Justin Perez. He is a perfecter, is great in performing visual vernacular, which we call VV, and he is great at what he does. He's a great performer. You can, deaf people or hearing people, it's like he is performing a movie, right? And so his expenses are a little bit higher than normal. We have to pay for his travel and for his performance fee. And the prices on everything have just gone up with the economy. So we want to make sure that we're able to perform, that we're able to host a good event. We know that everyone's struggling right now, but we are doing our best. It is November 19th, 10 to 4. It'll be a Saturday. There will be booths, performances, children's activities. The theme based on the Wizard of Oz. There's no place like DHC, like if they say in Wizard of Oz, there's no place like home. And Jamie's saying that yes, the timing is, because 2 years ago, what was that, 2019, we had voted on that theme already, and then COVID hit, we had to postpone for 2 years, and now that we are back, the theme is really just so perfect because we have not had an event for 2 years, so there's no place like home. So the decorations are fun. We've already started making some. Eloise has done a great job making some. And then also, just to kind of give you a little bit of an idea, but, you know, Cambria, the small town near the beach. I love going to Cambria with my daughter. We went recently, and there was it's a really cute shop. They have really cute shops in town. And they have their decorations up. So Dorothy with her dog and the Tin Man and all of that. So I already reached out to the city of Cambria, their Chamber of Commerce, and asked them what they're doing with the decorations after and if we could have them. So I'm going to work with them to see if we can borrow, have them donated, buy them at a fairly low cost, but I think it'll be fun. Remember, we're going to be in a larger room this time, so we have room for more decorations. The board and myself have been talking about tacos, vegetarian and meat options. So we're working on that, but we have a lot of planning to happen. So please come to BDF. It'll be fun. Do you want to talk about Christmas? Okay, later. Okay, more information to come about BDF. Thank you, Michelle. One thing I wanted to mention is that BDF has always been such a successful event. And that's because we also have a large number of students who attend the event. They're wanting to come and learn, experience something new in the deaf community, and also sometimes they're able to get extra credit for that. So teachers, please encourage your students to come. It's $15, which may seem like a lot, but again, if you're able to save $5 for 3 months, that would pay for your ticket. So it should not be too difficult and should not impact you financially too much. I know the cost has gone up, and like Michelle said, it's harder to also get donations because businesses are also impacted by the economy and the work that they are doing. And so we have not received as many sponsors or donations. Hopefully, if we receive more sponsorship, more donations, we can decrease the cost in future years. But thank you so much, Michelle, for talking about BDF. Next year, when we have our 40th anniversary of DHC, I want you to not forget about coming to Community Comments. This is such an important event. It's the opportunity for us to hear your feedback. And if you have any concerns or any ideas, you can fill out the survey form that we have at the front. We can also just bring that to our attention and we can discuss how to improve, right, events. If you're talking about money, right, we can talk about how to make those types of workshops possible. If there's something that needs to be fixed, we can get that fixed. It's really an opportunity for us to talk about what we need to do. And there are some things that maybe can be fixed now. Maybe, we want to make sure that we are able to fix and solve the issues for the quote unquote low-hanging fruit. And if not, we may have to budget or prioritize the other issues or concerns for things that need to be fixed or repaired, quote unquote. So yes, please bring those to our attention. This is the opportunity for you to do that. We want to be transparent. I think that's the key word here is transparency. That politics can get ugly. A lot of times people aren't transparent with what that is, and we want to make sure that we are transparent here and that we are fair to everyone and provide that opportunity for everyone. We want to also have that trust, and I know that trust can be lost very quickly. So it's important for us to develop that rapport and trust through transparency with the community. We're going to go ahead and start community comments now. If anybody has any questions or answers, we may not have the answer today. Michelle may be able to respond to some things, but we want to make sure that we can open the floor for this to happen. So please come forward. We are recording this today. It will be posted on YouTube later. And so anyone who's not able to come today is able to watch that on YouTube. Okay. Who would like to go first? I don't bite. Don't worry. Do you have something to share? Okay. Hi, everyone. My name is Darcy Lassard. I just graduated my master's. That's great. Thank you. Yes, I'm very excited to be more involved in the community. I focused my attention on school now that I have done that. I also was involved with CAD, the complexities of that, but now I want to focus more on what is happening in the local community. There have been some issues. Students now becoming staff have been struggling with VRI as well. I'm not crazy about VRI. I understand the purpose of it. If there is a situation where they may not be very serious, but if there's something serious happening and I have to sit and look at an iPad, if the VRI has froze, so I work at FCC, or I also teach in Oakhurst, so I work at the community colleges. The internet's not always great. Sometimes Zoom freezes. We may have an interpreter's not always available. It's very frustrating. I like to have in-person live interpreters because they more know who I am, they know my signing stuff, they understand what is happening in the meeting, the context, and with VRI, they have to interrupt a lot and say, hey, how do you say this? How do you sign that? And it's like, I'm in the middle of teaching. You can't just interrupt. Your job is to interpret and to know what it is. And if they're asking me, I will ask the person, hey, are you certified? And I'm like, no. And I'm like, wait a minute. The interpreter's not even certified and they're working for Wilder Interpreting Services. I will ask the interpreter, you sign well, but you don't understand my signing. And they say, oh, well, I grew up with a best friend who was deaf. And I'm like, well, that doesn't make you a qualified interpreter because you were friends with one deaf person growing up. So, I'm here to ask the community if they would accept and continue working with people, but we need more interpreters, both VRI and live in-person interpreters. We have to be flexible, but we also don't need to just accept anybody and everyone. If some people want VRI, that's up to them, but I prefer to have in-person interpreters. Of course, VRI is not preferred, but it is a last resort. And my concern here is that interpreting services are not always provided in a timely manner. And it could be the coordinator who is dispatching or calling for interpreters. They say, hey, we need an interpreter. I don't know exactly where the concern or the issues are. There may be somebody coming from another college from one to the other to provide services. And so once we have more students at FCC2, and the students are being required or forced to use VRI services. But there are some who even need deaf interpreters. And who's fighting for them, right? I'm here, I'm a staff now, but I feel divided because I have that student perspective and that staff perspective. And it's not easy, right? And again, HR doesn't 100% even understand what the purpose of interpreting services are for live interpreters versus VRI interpreters, when it is good, how it applies to the ADA, and me as staff even. I need an in-person interpreter sometimes, and they'll say, oh, well, other deaf are complaining, saying that, other interpreters are full for the whole, they're busy this semester, not available. But I'm like, well, what about communication, right? I need to have access to communication to my students. If I have an interpreter in my classroom, right, the interpreter is for me, it's not for the students. And some teachers have complained, and they say, well, will you learn better if they're signing, which I actually disagree because I did an experiment of my own. I kind of tested it out to see what it looked like to have no interpreter for 1 year. There was a lot of frustration, a lot of issues, and I lost a lot of students. The student retention that year actually decreased when I didn't have an interpreter. I had an interpreter with me the whole semester, and they stayed with me the whole semester. They maybe left a couple times. And again, because I have all hearing students, when I had an interpreter and I was teaching, I was able to expand more on information, explain things better of why something was one way or the other. And if I can't explain and the students don't understand, or I can't explain that to them in ASL if they're not fluent enough. So once I have an interpreter, right? But again, I can't always use a VRI interpreter for that. So yes, I just am begging that services be improved for everyone. And we're fighting against agencies, companies, businesses who don't understand our rights. And unfortunately, right, most people didn't want to know about ADA and advocacy. Most of people were asking about other services. The ADA and advocacy were not up there, right? But I'm here to say no. Everybody must know about the ADA and must know about their advocacy and what they can do for themselves. If there's no interpreter that day, that is violating ADA. If they said, oh, we don't know, or oh, it's fine, or something like that, right? No, they need to know about the ADA law. And if you are more informed about ADA, you can protect yourselves better. Talking about ADA and advocacy, and I will tell you too that, I've had to explain this to many people. And then once I'm able to explain that to people, then they don't have a valid response at that point, right? It's already been since 1990. It's been revised a few times, but since the 90s now, they had a book in the 1990s and that explained the law, explained accommodations. It is in print, it's available online, and I feel like people should know exactly what their rights are to be able to protect themselves as an agency, as a community, for your future, for your journey, for the work that you do, whatever it may be. They need to know what their rights are. So it's really important to know your rights. Thank you for your time and for the time I took. I just want to make sure that it's important that we have interpreting services improved, and then also that people know more about ADA. Thank you. Okay, advocacy, right? Advocacy, knowing your rights, being educated, being able to educate. And DHCC is here to help. Here to help ADA, here to help protect and to help. ADA is the Americans with Disabilities Act. It was signed into law by President Bush in 1990. The ADA is not perfect. It says qualified interpreter. But what is qualified, right? It doesn't say certified, it says qualified. And so, right, the focus, ADA also is applicable for people who are in wheelchairs, people who are blind. And when it was signed into law, there were some things still missing. Again, it's better than nothing, but thank you, Darcy, for sharing your thoughts. And Michelle would also like to respond. Thank you, Darcy, for bringing this up. Two things I would like to respond to. I have read a lot of research that says that the reason that VRI has expanded and is being more popular because there hasn't been enough interpreters. And that was their response to not providing enough in-person interpreters, is that they founded VRI companies to meet the needs for the lack of interpreters. So we, though, want the young people, when you graduate high school, to start thinking about maybe becoming an interpreter, going into an interpreting training program, pursuing their certification, right, to become a certified interpreter. And some people said, oh, I didn't even know that interpreting was a profession. And so we want to be here to encourage people that this, and to educate them, this is a career opportunity. Again, that's why VRI has increased. Also for ADA, for the Youth Employment Services, yes, our staff has been using that time to teach about ADA and Section 504, the disability laws, so that those who are in K-12 right now know their rights when they go to college. So there are high school students, right, before they go to college, but like Darcy said too, we also need to know our own rights. And a lot of people don't know their own rights. They may not care to know their own rights, but to know your rights about your health, about your body, about what is happening to you, around you. We want to increase the people who are interested, the number of students who are interested in the interpreting profession. And then also that's another reason why we're providing the ADA workshop this afternoon, is to expand people's knowledge. Yes, thank you, Michelle. We are providing that ADA workshop. We talked about VRI 2 years ago, and because of COVID, the conversation kind of stalled, but we are here to continue talking about VRI issues. And we want to make sure that we're not repeating the same mistakes over and over, and that these can be, where things can be done well and right, and people's needs are being met. So thank you so much, Darcy. Who would like to comment next? I believe you had your hand raised earlier. Did you want to?
Oh, you pointed at me. I thought. So I need an interpreter.
Go ahead.
Hello, good. Thank you for having me. Thank you for interpreting. My name is Maximilian. I'm with Ember. I was brought awareness to you guys' group by my partner, Meredith Thomas. We're from Cleveland, Ohio, and we work with Ember. You talk about there's a lot of prices going up in everything, and the price of energy has increased. In 2023, the price of energy for electricity, PG&E raised the bill by 22%, and they plan to raise it up to 18% in 2023, and that's over 100% increase in the last 10 years. There's an energy crisis with California. PG&E is pulling energy from out of Nevada and other states, and what we do is we offer renewable energy to allow for the community to control their energy usage and their prices for energy. We work with solar systems, and we measure custom-built solar systems to the energy usage for each individual homeowner to allow control and less expenditures on their energy. And just like a mortgage or a car note or insurance, we put a fixed rate that is typically between 50 to 70% less than your normal energy consumption costs. So we want to extend ourselves to the community. So if you want help with your energy usage, if you just want to find out if you can save some money by using solar energy and renewable energy, which is better on the community and the atmosphere, it takes about 25 pounds of coal every day to fuel our energy for our houses. And we get away with, we would erase that by using the sun and green energy. And we just want to extend ourselves to help you. If you would like to speak with us, please let us know before we leave. And any information we can lead to is with. Thank you very much. I appreciate you.
Thank you. Yes. Thank you.
You're welcome.
Okay, we want to make sure that we keep the remaining of comments applicable to what is happening at DHSC. You can introduce yourself and then share your comment.
Hello, my name is Jesus Soto. And I wanted to share some comments about VRI. I am in agreement with what Darcy was commenting on.
Going by lucky.
For example, just a couple weeks ago, I had an appointment. It was with Fresno Central. And I had received a call that I would have an appointment on Wednesday and that I would be having to use VRI for the meeting. And I had told them, I said, well, I would prefer to have an in-person interpreter, not VRI, because the technology isn't reliable. Sometimes the screen goes black. And it would be better to have an in-person interpreter, and so they wanted to cancel the meeting. And I said, I wouldn't mind having the meeting if I could have an in-person interpreter. But I do know that there isn't a consistent response that we're getting from different groups and businesses in regards to that. So I did get the call back about that appointment on Wednesday, but they let me know that an interpreter in person wasn't going to be available, so we had to reschedule the meeting out. And thankfully they were able to find an interpreter for my doctor's appointment rather than having to use VRI. But I know that a lot of members of the community are experiencing these types of situations. I mean, I know that the Fresno Cancer Center knows my preference and need to have an in-person interpreter and the reasons why VRI isn't reliable, and it could end up also being a waste of their time if they call in a VRI interpreter.
So that's another thing, like what Jesus just mentioned too about VRI and the use of technology, right? Having an in-person interpreter doesn't rely on technology. And so you must have good Wi-Fi to have clear VRI, a clear screen, a large enough screen. It takes a variety of things for even VRI to be done well. And it's not just how or if you should have an in-person or VRI, but actually how VRI can be done successfully. So like Jesus said, right, not having a clear picture, losing internet connection. And so those are things that people need to know about VRI as well. And I think that a lot of people aren't aware of that. Michelle's asked me if I can add something. Yes, I wanted to add to what Jesus had just said, and for the community to know now, because we are seeing interpreting issues a lot. We are frustrated with the blame putting back on us of why there's no interpreter when one wasn't requested. If one is not being requested, you can't just say, oh, you didn't have an interpreter when they never requested one. So I wanted to make sure that I make that clear, that that is a frustration we have here. The best way is for you to say, I have an appointment, and they say, please call, or let's say you have an appointment September 5th. You can say, did you already request an interpreter? They say yes. And you can ask, where did you request that from? Make them tell you who they got in contact with and the name of the interpreter that is going to be coming. Because oftentimes they'll say, oh, I forgot to request. And then they say, oh, sorry, no one was available, when they never actually requested or reached out to us for our services. So make sure you get on them early enough in advance to ask them which company they contacted and who the interpreter is. Because that's not really fair that the blame is being put on us and they're saying, oh, DHGC wouldn't provide an interpreter. If we get in contact with them, we do our best to do that, but if it's only a week or two in advance, the chances are less likely we have someone available versus if we had somebody who requested interpreters with more advanced. It's not just magic, we can't just clone interpreters. Of course we need more interpreters, but that's where advocacy comes in. To say, did you call DHCC? Did you request an interpreter? Okay. You want to add something, Jamie?
I had a similar experience when I called in. They were on me about not having the interpreter, and I had to turn it back on them and tell them that it was their responsibility. I told the gal I was talking to that it's not my responsibility to find an interpreter, especially waiting until the last minute to try and request one. I mean, I was frankly pissed off that we had to reschedule and push out a meeting, and this was a serious issue because of what we were going to be discussing. And so when I was on VRS, the interpreter was a CODA through Sorensen, and they told them not to do that again. So then the next time I had to call HR, and I had a form that I had to provide to them. And so a meeting was held with all of the nurses for them to understand what the process is. So I had to be in a position to educate them on the rights, because I mean, this was going to heavily impact my life.
That's a really good example, Jamie, of the deaf people are not responsible for providing the interpreter. DHHC has an interpreter coordinator, and they also have advocates. But let DHHC do their job too. Right, so what I'm saying though is that DHHC can follow up. They can make sure that the office is following what they need to do to get an interpreter. So a lot of times they don't know. And once they're educated, they may be more willing to do it. But just, there's a lot of issues with VRI. We could be here all day talking about that. But are there any other issues besides VRI that would like to be brought up? I know, again, this isn't, if there's any other issues not related to VRI, I want to be able to make sure we can hear from the community.
Hello, my name is Janelle. I am from Fresno. And my experience with VRI had to do with me going into the emergency room. I had an infection, and they brought out the screen where the interpreter would be through the VRI, and they already had it set up for me, which I'll say that is one positive aspect, in having to wait over an hour. I mean, for an in-person interpreter, they were able to just get it started and provide that access in that way. So, I mean, that is a pro for a timeliness comparison.
Right, I think there's a time and place. So when and where VRI is effective and when it's not. They'll go into that this afternoon during the workshop. But yes, there are reasons and a good time and place to use VRI. So thank you, Janelle, for sharing that. That is one of the stories that we have seen and heard of one that has been effective. And I'm happy too that everything worked out. Is there any other comments or a different issue? Darcy? Hi again, Darcy Lassard here. For a different issue or a concern for the community. I just went through some life changes, and I had to call Section 8 And I learned something new. They are not open. So I applied, and they had my file, but I was not accepted. And there was a cutoff, so I wasn't able to get my business taken care of. But I was on the list since 2017, and I'm no longer on the list because I did not show up, is what they said. So I said I never got a phone call, I never received a letter, and I never got an email. And they said, oh, well, I'm sorry, we can't put you back on the list. They said, I'm sorry, but you can reapply, but now they're not open. So it's federal money, and it's a mess. But just wanting to make sure that there's really a domino effect, right? How they are handling those in poverty and the domino effect of what happens. So I'm just asking you all to start and keep taking care of yourselves. Find a way to live. It's unfortunate too because I am working part-time and I had to move, and the services are also being cut because there's not enough money at the federal level. And we voted for that. So it's hard. I'm worried about myself. I'm worried about others, deaf people, those living in poverty, and there are more and more people that are homeless. And they just said they just passed a law that they're going to protect those who are homeless. But I don't buy it. It's very serious. Darcy, I agree with you. They were helping. Section 8 used to be great. And with the previous administrations, but now the way things are being run are not as effective, and things are being cut. And I don't think they should be. So it's that domino effect that you mentioned, right? Having to try to clean that up and trying to reverse what has happened. And it has to go through the House and the Senate to be cleaned up. The problem is, though, is that there's filibusters. And the rules, it's at 60-40. So it has to be at least 60-40 before things can get passed. And right now, the Senate and Democrats, Republicans are about 50-50. So things are not getting passed. They each have their own agenda. Each party has their own agenda. And it's really just the parties that are ridiculous. Yeah. But Section 8 is important for a lot of people. It helps a lot of people. And what has been good about Section 8 outweighs what's been bad. But things need to be improved. But there needs to be money. And I think that they should find a way to be able to fix that instead of just closing the services. And Obamacare, right, helped a lot of people. It helped a lot of people get insurance. But there were things that needed to be fixed. And Obama said, if you have a better way to do this, something better than Obamacare, please, I welcome that. That's what he said. Right? And so we need to stop with those political parties and political agendas and what's going on, and just better the country for its citizens and for the people who live here. And yes, they just passed the drug cap, which took forever because pharmaceutical companies were able to make up whatever price they wanted. $900 for a month's worth of prescription drugs. And it's been ridiculous. It's ridiculous that medication costs so much. But, right, we need to make sure that we're able to stop these companies from just doing things just for a profit. But it's greed. It's really greed. We need to find the way to stop these negative effects on the people who live in America. So contact your local representatives or your senators. They will listen to you. They have to listen to you. They're here to support us. We've voted them in and they have to listen to us. And as a board, we are also here to listen to you, to listen to the community. We are here with open eyes to see your comments and make sure that, things are handled appropriately. What other comments are out there? You want to make a comment? Okay, sure.
Now, in terms of like a CPS report that a teacher may have to make, or a welfare check, like for Deaf and Deaf Plus, what I've noticed is that probably in the last 3 years, like if an interpreter is sent out on those types of jobs, I have seen mixed responses. If an interpreters are going out with the police, and for example, last year, I'm a little nervous, but yeah, last year in the deaf program, an interpreter was willing to go to the house with the police, but it did feel like it was a little sticky, so to speak. And so, I mean, I know that the interpreter would be there for this child, but also, like with the welfare check, I called a few times and asked if they could go to the house to check on the students, see if they had enough food or whatever it is that they needed. And it got a little, I told the police that they would need an interpreter there. And so if the student has a lower language level and Deaf Plus, that's also the reason to have that type of more specific access. And so, but oftentimes there wasn't an interpreter, or even an interpreter with a deaf interpreter alongside. And so I've just seen a lot of variations relating to that.
Yes, that's a good example, right, about interpreting services. Even about welfare services, welfare checks, right, that has to do with government funding, and the government should be providing services and accessibility. So DHCC again is here for you, for your clients, to advocate and to fix these issues and concerns in terms of accessibility for whatever the program needs, whether it's a welfare check, whether it's a serious issue, maybe there's misunderstanding in terms of communication, maybe even at CPS, and parents were being taken, or kids were taken from deaf parents, but they didn't know what the difference or why or anything. And then maybe a neighbor said, hey, they're not taking care of their kids because, or they can't take care of them well because they're deaf or something, and they got the kids taken away without having those conversations with the parents. There's been cases that have happened that I've seen over the years. And so it's important to have an interpreter there so that the parents have a right to explain themselves and not just assumptions to be made about them. Or that other people can just make up things and call CPS, right? We all have to kind of be careful. Right, and it has to do with accessibility. In the 80s, I worked for a nonprofit organization in Sacramento, which, again, there was an oral school there, so there was a lot of listening and speaking, not as much of a signing deaf population. And when parents found out that I signed, they didn't want me to be there, or they wanted funding to be cut. And so it impacted hospitals. If they knew that I preferred someone who assigned, they said, oh, well, what about listening and speaking? If that's their right, you know, they would think it was their right to not promote or support the use of sign language. But yeah, things have changed and they've gotten a lot better. But there's still some work that needs to be done. And there are things that are still happening that people don't see or don't recognize. So it's important for them to be brought to their attention, as well as, you know, before it was referred to it with a different acronym, but knowing that what my job was at work and having to make sure to inform people and to know what was being provided access and what wasn't, and if we needed someone from immigration or someone who spoke Spanish or somebody that was in jail, or someone who knew ASL or didn't know ASL, or maybe even just knew the basics, or used home sign or something like that. But and then this is what they would sign for police. This is one sign I saw for police. Yeah. In Mexican Sign Language, because of the uniform that they used to wear and that type of hat that they would wear. They would say, I was arrested and I'm not sure why, and I would talk to them and see what was happening and realize that they were running and didn't know who was coming after them, and the person looked different, and so they had ran, and they didn't realize that was going to get them into more trouble. They didn't mean to run necessarily from cops, but they were in jail for 2 weeks because of a misunderstanding. And again, that had to do with communication access, or lack thereof. Right, they knew home signs. But right, they weren't able to communicate with them effectively. Okay, any other comments? Don't be shy. Yes?
Can I get the interpreter? My name is Meredith, but thank you. My sign name has always been Meredith because I smile so much. But I just wanted to add on to, because my partner was a little nervous and he didn't, I feel, properly explain why we were here. So we are partnering with the United Way and other community groups to try to do education for helping people to understand about the overwhelming energy cost. And we're coming across a lot of especially elderly who are unable to even turn on their air with this hot weather because they're terrified over, what that bill is going to be, what it's going to look like. We were working with an elderly woman because she was getting way overcharged in the wintertime to try to figure out what's going on. So what we're trying to do, when I saw this community event, it started me thinking about how many people don't know and understand what this process is for getting solar and for even trying to help with their energy bills, and thinking that maybe partnering with this group that is providing interpretation services for people who want to know if this is something that can be helped. We don't just come in and try to slap on a solar system no matter what. We want to make sure that this would help someone, that we look at their bill and situation and say, here's where we could be, here's if you stay the same, and completely up to you. And we just, leave it to you. And if we can't help you, we're very honest about that, because we don't want to add even further burden to a person. So that's really why we connected here and felt that it was a good idea to speak, because education is important. And there are a lot of communities that get left behind because it's too hard to talk and it's too hard to explain. So I figured, if we go around and just try to reach as many people as possible, that we can, do our part to spread education. So thank you very much. Yeah.
Okay, thank you. It's great to have community partners and see where we can better serve our clients. It's almost 12 o'clock. Did you want to add something else? Are you guys tired of me yet? Just kidding. So my last comment. I suggest how we can get more people is to change how we promote. So for this event, for community comments, there were a lot of words, just FYI. So if we could, I think it's how we are promoting and graphic design. So how we can attract more people. If there's too many words, people aren't going to read it. They're not going to come. If we are able to just talk about specific highlights and not have too much on there, I think people, again, would just dismiss it. So if we had a vlog and then with a short flyer with less words, I think that would attract more people. A lot of people aren't going to read all of the text. So just, basics on there, time, place, location, date, I think would help. Just my 2 cents, one thing that I noticed. And again, I'm in graphic design. I worked for the yearbook, worked on the yearbook and all of that, and so I'm familiar with that type of stuff. So thank you so much. Yeah, I think there's just too many words. So if we just said time, location, date, time, location, it was more simple with just a few graphics and not so many words. Did you guys see the flyer for today? I saw it and I had to read through a lot. It was a lot of reading. Right. So, right, it depends. It's not your fault necessarily, but it's really just if we were able to have that signed and then have the graphic as well. I think that's just a suggestion. If some people aren't fluent in English, then if we were able to have it translated or something. And Steve saying, well, before we did have a flyer and a video of it signed in ASL. So if we were able to have the flyer and the video, I think that would be helpful. So they could access the information in both languages. It was very wordy. So if it just had more simple details, we could do that. It may be easier if we just had the time, location. So just a comment on that. Michelle wanted to add. Yes, thank you. We want to know what's working for you. Because the same idea as before, when we had the community email blast, some people said, oh, there were too many emails. We cut down on the emails. People said, oh, then the emails are too long now because we're not sending them out as often. So we are trying to adjust to see what works. Blogs, videos, yes, we're trying to balance the amount of time that it takes to make a flyer and a video. But yes, that brings me for a opportunity to recruit you to make the blog for us. So then it will make the board visible as well. Right. So now we will wrap up. It's almost noon. Remember, this afternoon we have the ADA workshop to talk more about VRI, and we will be able to, they'll share more information this afternoon. Any final comments? Lunch is provided. Yes. Thank you. DRC is currently with us. You're a paralegal, is that correct? Okay, yes, a lawyer will be here. Can she come and talk about this afternoon? Remember, you were involved with legal services, and then also I've seen you on the Daily Moth.
Other time.
Have you guys seen her before?
Other time to watch it.
Thank you. Okay, hi everyone. My name is Callie Fry, is my name sign. I'm with Disability Rights of California. This afternoon, 1 to 5, somewhere in that time frame, I will be presenting about the ADA as well as VRI services. I think it's important, the first step is for you to know about the ADA, about self-advocacy. And then this afternoon, we'll also talk about, we'll have a community discussion about the issues that are here. For lunch, we are providing lunch 12 to 1. We have chicken and Swiss rolls. I have a platter with us. We also have croissant sandwiches. And they are ham, turkey, and roast beef. Also have salad for any vegetarians. That's about 3 or 4 people. We have oranges, water, and a variety of chips. And hope you guys stay hungry and are looking forward to eating with us 12 to 1. And we will see you this afternoon, hopefully. Thank you so much for Michelle for having me. I really appreciate it. Okay, that wraps up community comments. I really appreciate everyone for being here. And we will continue to have more events. You can look at, look forward, hopefully next year we will have more people in attendance. And then, yes, continually improving what we provide. And we wouldn't be able to do that without your comments and your feedback. So thank you for sharing that with us so we can do what we do better. Again, thank you for coming, and I hope you enjoyed your morning.